Welcome to the Megan Clare Show. I'm a breast cancer survivor, patient advocate, and your host, Megan Clare Chase. I am working with Ancora AI to help share their mission, which is to bring unbiased and comprehensive information to patients and bring vetted clinical trial options to all patients. Now, March is Colorectal Cancer Awareness Month. To tell us more about this type of cancer and symptoms and getting the caregiver's point of view, I am thrilled to have Amy and Garry Studer with us today. Welcome.
Hey, hi.
How you doing?
Hey. So glad to be here.
It is so much fun when you get to meet someone over social media, and actually get to talk to them. You're real.
Oh, yeah. This is exciting.
So, Amy, tell us about your specific type of cancer, starting with your symptoms, and then how did you know that something was seriously wrong?
Well, it's almost been exactly 5 years ago. I noticed blood in my stool, and it was a very small amount, but there was still some blood there. And I, kind of put it off for a couple days, and I kept watching it. And then finally I told him. I was hoping it would just go away, but the truth is blood in your stool is never good. It's not necessarily cancer, but it's never good.
Right.
So after about a week, I made an appointment with a gastroenterologist to find out what was going on.
So, how did you get the news? Were you two together, or did you even think that it could possibly be cancer? Were you surprised when you got that call, or?
Well, we were completely shocked. I have no family history of colon cancer. I believe my parents have had a few polyps removed, but nothing, never colon cancer. And I actually have a friend of mine who's a gastroenterologist, and I contacted him and I said, this is what's going on. And he's like, go in, get seen, get a colonoscopy, and you're going to be fine. It's the whole, you're going to be fine. Probably something minor, but just get it done just in case. And we found out when I woke up from the colonoscopy, the doctor came in and he looked at us both and said, there is no question it is cancer. It was before he even sent anything off. And he said, what's going to happen is, you're going to need to meet with a surgeon. I mean, he rattled off all these steps that next steps we were going to have to take. And I think we just stood there because he was blown away. The doctor's eyes were even like, I have something to tell you,
Oh my
we were very taken aback and just stunned, really. I mean, just sort of shell shocked because, I didn't think it would, I didn't know what was wrong, but, I was certainly hoping for the best.
Right.
But, so it sort of spiraled from there. I don't know your reaction.
Well, first we thought, let's try changing the diet, right? Before we went and saw a doctor. That didn't work. So she kept having blood in her stool. So when she did go in for the colonoscopy, and when she came out, it was, I don't know, it was kind of like surreal. He was very direct. He said it was the size of a grapefruit.
That's what he told us.
And I'm thinking,
yeah, that's what he said.
I'm thinking it round all the way around.
Right.
Yeah.
Well, obviously it wasn't round, but it was the size of a grapefruit, which at that point my heart just sank.
Yeah.
And I looked at her and I tried not to cry, which
I know.
I get very emotional.
I know, we get emotional talking about it.
I squeezed her hand, and then another doctor came over and he was like, you know what? This is going to be okay. This is one of the type of cancers that if you catch soon enough, early enough, they can take care of it.
Yeah.
So.
And he said, this is going to end up being a small blip on your radar. And of course we were like,
Yeah.
It doesn't really all you're hearing is cancer.
Yeah.
Right. So, so she got dressed. We went home. We went upstairs into the bedroom, looked at each other, and started crying.
Yeah.
So that was my experience getting the news.
Oof.
Yeah.
Wow. Tell me this, Garry, as Amy's partner and caregiver, like what was going through your mind knowing, she got this cancer diagnosis, what the treatments were going to be that could be grueling. What was going through your mind and how did you cope with that?
Well, I guess like anybody, I was afraid. I didn't know, you always hear about the treatments and people losing their hair and getting sick and not being able to work. And, you kind of feel like you're on your own little island, you know.
Mhm.
Um, I took a day and kind of looked at all the pictures we had around, and I was, talking to God, like, you know, let me do it, give it to me. I'll take it. Right. I mean, again, very emotional, but, I just thought about the kids. I thought about, because she's the funny one, right? She's the one that is the glue to this family.
Well,
She's the one that,
he is too.
that we always have family dinners over the weekend. We get all the kids together, we have all their birthdays and everything. And I just kept thinking about that. And I was like, she has to be here for all of that. So I took a day, maybe two, to just kind of, get it out of my system, cry. And then I just started thinking, okay, we're gonna do this, and we're gonna do this together. So, from that point through all of her treatment, we stood together.
Yeah.
And, it was rough, but we did it. So.
And the thing is, I mean, we know not everybody is as fortunate to have a partner or someone, like a Gary,
Right?
inside. And if you don't, I mean, it's got to be very, very difficult, that much more difficult for people. So